It's time for a Wellness Revolution. Brought to you by Hotze Health and Wellness Center. Honest discussion on maintaining health and wellness naturally to enjoy a better quality of life.
He's the doctor fighting to let you keep your doctorate.
Now, Dr. Stephen Hotze. Dr. Hotze's Wellness Revolution podcast is brought to you by Physicians Preference Pharmacy, formerly Hotze Pharmacy.
Welcome to Dr. Hotze's Wellness Revolution. I'm Stacey Banfield here with Dr. Stephen Hotze, founder of the Hotze Health and Wellness Center. And just as a reminder, you can always download our podcasts at hotzepodcast.com. That's Hotze podcast.com. We've got a lot of information on there for you to check out. Well, today we're going to be talking about the ladies, so women's health. And really, ladies, if you are experiencing an energy drop, if you've got some mood swings, if things just aren't the way that they used to be when you were younger, it might actually be your hormones. So Dr. Hotze is going to talk about that today. Dr. Hotze.
Thank you so much, Stacey, and thank each one of you for joining us today on our program. I do believe that you and everyone really deserves to have a doctor and staff of professionals who have the know-how and the wherewithal to coach you onto a path of health and wellness naturally without using pharmaceutical drugs. So as you mature, you've got energy, you've got vitality, and you're enthusiastic about life. I mean, if we're going to be alive, why not enjoy it and be enthusiastic? So that's what I want to encourage every one of you to do, is do a 180 and take charge of your health. Today, we're talking about women's health. And it's the same thing that happens to men as well. As we mature and age, inevitably, our hormone levels decline. Now, let me ask you this, ladies. Are you feeling sick and tired of being sick and tired? Have you been to your doctor and told him you have no energy or your energy level's down? You can't lose weight. You can't think clearly. You're having mood swings. You're getting panic attacks. You're anxious. You don't sleep well. You got joint and muscle aches and pains. You got sluggish bowels, or you got irregular bowel movements. Your periods are not right. They're heavier. You got cramping. You got premenstrual symptoms. You have headaches. You just don't feel well. And you go to the doctor, and he says, well, we'll just do some blood tests on you. And does the blood test, and they all come back normal. And so the next thing you know, they placed you on a pot full of drugs. One thing, you're on sleep medication. Oh, you're on anti-anxiety medication. Oh, now you're on antidepressant medication. And then they got you on something for your bowels. If they're sluggish, they give you something to help move them. If they're too fast, they get something to slow them down. Your periods aren't right, they put you on birth control pills. Your joints are swelling, you got anti-inflammatories. You're overweight, you got pre-diabetic syndrome, you're on metformin or some other diabetic medication. Your blood pressure's up, now you're on blood pressure, and you're just on drugs. And it all goes back to the inevitable aging process, which is the decline of our hormones. Now, the hormones can become imbalanced during several phases of life. At puberty, some women, their hormones don't balance out. When they take birth control pills, you're absolutely shutting off your normal occurring hormones. After childbirth, it's very common for women not to have their ovaries turn back on right and begin to balance out the hormones. Because during pregnancy, the last half of pregnancy, the placenta is the dominating factor in a woman's body that produces the hormones. So a woman's ovaries are basically shut off, and when she delivers the baby and delivers the placenta, guess what happens next? She's got to turn back on her hormones. If they don't turn on right, then she's got an imbalance, and that can cause problems. After a tubal ligation, that can cause hormonal problems because it's all part of the blood supply to the ovaries. So it's post-tubal ligation syndrome. After a hysterectomy, if it's just the removal of the uterus, which in lay terms they call that a incomplete hysterectomy or partial hysterectomy. That's not really a medical term. It's a lay term. When you take out only the uterus, if you take out the ovaries as well, the lay people say it's a total hysterectomy. Well, really, when you take out the uterus, it's a total hysterectomy. If you take out the ovaries, it's a bilateral salpingo-oophorectomy. Oofer is ovaries.
What a great
Oophorectomy
name.
is removal of the ovaries. So whether or not you have a partial hysterectomy, a total hysterectomy, there's going to be some hormonal imbalances that occur. And again, it leads to a host of health problems because the hormones don't just affect the uterus. They affect every cell in your body, from your brain cells, heart cells, liver cells, stomach. Every part of your body is affected by your hormones. And so when the hormones are declining and become imbalanced, women have a host of health problems which are manifested by these symptoms. So what do? Well, the key thing is when you begin to have your symptoms of irregular menstrual cycles, by that I mean this, say you start off at puberty, you're having your cycles every 3 to 5, they're lasting 3 to 5 days and they're mild. And then as you get a little bit older, maybe you have childbirth, maybe now they're 5 to 7 days, a little bit heavier. Now you're getting into your mid-30s, 40s, and all of a sudden they're 7 to 9 days, they're clotting, you get some breakthrough bleeding. Doctor says you got fibroids, you're getting premenstrual symptoms, you're getting mood swings, fluid retention, headaches, breast tenderness. You just don't feel well. You're cranky. 1, 2, 3 months out of 3 weeks out of the month. And you just don't feel well. And you go to the doctor, and they pile on all these medications on you, tell you your blood's normal. Well, it's not. So what you're having is what we call progesterone deficiency or estrogen dominance, which can be easily corrected by taking natural bioidentical progesterone day 15 through 28. This can be given to young girls in puberty, low doses that can help balance them out so they don't have their menstrual problems or mood swings that we see commonly in young girls when they enter puberty. Their hormones are going wacky and they don't feel right, but they can be balanced out with natural progesterone day 15 through 28. After childbirth or in a woman's 20s, we may add a little bit more. In the 30s, we add a little bit more progesterone. And then by the time a woman hits perimenopausal in her late 40s and into 50s, then we add more progesterone, and then we balance it out when she's in menopause with some natural estrogen. That can be done, and it can restore a woman to really good health. She feels good again, feels normal again. By taking natural progesterone, when you begin to have premenstrual symptoms, you can prevent the problems of the dysfunctional uterine bleeding and the fibroids, which end up leading to hysterectomy. So start it early enough, you can prevent hysterectomies very easily. That's very important. The other thing, when a woman has her estrogen dominance and progesterone deficiency, this adversely affects her thyroid function at the cellular level, because when she has estrogen dominance, when it's the dominating hormone and the progesterone levels have fallen so they don't balance out well, here's what happens. A woman's liver makes thyroid binding globulins, which bind up the thyroid hormone, and they're not properly assimilated and taken into the cells. And therefore, women, their energy level goes down, because thyroid is what enables your cells, thyroid hormone, the active thyroid hormone T3, which has 3 iodine atoms attached to it. It's the active thyroid hormone. It has to enter your mitochondria, your power plants, and enable your cells to produce and use energy. And if you don't get enough thyroid into your cells because you have thyroid binding globulins, your female hormones are imbalanced, that adversely affects your thyroid function. So
and Dr. Hotze, one of the things you also like to say, I know, is that that's one reason why blood tests are not effective, because they could say, oh, you've got plenty of thyroid in your blood test, but what if it's not getting into your cells?
That's that's the key point.
Mm-hmm.
And we make, it's 95% of the people that you do a thyroid blood test on are going to have thyroid within the range of the lab. Now, and here's how they define what the range is. They take the last 1,000 people, take their blood test, and they call that the mean, whatever the average is, and they add 2 standard deviations. That's a statistical term. So it's as wide as Grand Canyon, tall as the Empire State Building. It encompasses 95% of the people fall within that long, tall, or wide range. And the doctors say your tests are normal, or maybe you're low but not low enough to be treated. Here's what I believe. Anybody that has the clinical symptoms of hypothyroidism, low thyroid, deserves a therapeutic trial of natural thyroid. You start on incremental, small doses and incrementally increase and see how they do. If they do better, then you've made the diagnosis based upon their clinical history, not upon the blood test alone. But routinely, doctors will only use the blood test. And when you come back in the normal range, everything's normal. But I'm not normal, doctor, but your blood's normal, so you must be depressed. That's when they start throwing all these psychiatric drugs at you. And those can cause a host of health problems. They make the pharmaceutical companies a lot of money, but they can sure cost you your health. So we highly recommend being evaluated for hormonal decline and imbalance. And that's what we do here at the Hotze Health and Wellness Center. I've written a book, Hormones, Health, and Happiness. Every doctor should read this book. I wrote this in 2005. Nothing's changed. if doctors around the country would practice the way we practice here, it would be a dramatic, healthier country, and women would not have all the problems. We wouldn't have all these people. 30% of the women, upper income women, 30% of the women are on antidepressants and anti-anxiety medication and sleep medication. And that is ridiculous. Nobody is depressed. Nobody is anxious. Nobody lacks sleep because they're not taking antidepressants, anti-anxiety medication, or sleep medication. Internally, the hormones decline. It can be hormonal decline and imbalance, lack of thyroid hormone, vitamin and mineral decline, and not having the proper vitamins and minerals to enable your body to function healthy, improper eating, lack of exercise. All these contribute to people being unhealthy and not feeling well. The solution is not pharmaceutical drugs. The solution is eat healthy, take charge of your life, eat healthy. We recommend a ketogenic eating program. Second thing, balance out and replenish your natural hormones. Take vitamins and minerals, get on an exercise program. If you have allergies, we can test and treat for that as well.
Absolutely. Dr. Hotze, thank you for explaining all that to us. I mean, as a woman myself, I know what it's like to feel healthy and well and to not feel healthy and well. And it can make all the difference in your quality of life and the lives of those around you. So if you go to your doctor and he's trying to put you on various drugs, get a second opinion. Try and find a doctor that's open to natural approaches to health. You can also give us a call. We'd love to have a conversation with you, 281-698-8698. You can also go online to our website, hotzehwc.com. That's hotzehwc.com. You can take some of our symptom checkers. You might be hypothyroid. That's a kind of a quick way you can go through the symptoms and see if you might need some additional help. So again, you can always call us at 281-698-8698. Thank you for joining us here today at Dr. Hotze's Wellness Revolution.
A special thanks to Physicians Preference Pharmacy, formerly Hotze Pharmacy, proud sponsor of Dr. Hotze's Wellness Revolution podcast.
Information provided on this radio program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution radio program advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this radio program is at the listener's discretion.